Let's begin here tonight with a little perspective. Ebola has...
Tonight, the Centers for Disease Control and Prevention say it should have handled the first case of Ebola much differently. This afternoon,
Malloy will address the public this afternoon with an update on state preparedness for the Ebola emergency.
The Yale New Haven Hospital admitted a patient last night who met the threshold to be monitored for Ebola virus disease.
There are now more than 10,000 cases of Ebola worldwide. And when one case hits close to home, preparation is key. Centers for Disease Control and Prevention have confirmed a case of Ebola in Dallas, Texas, and one in New York City. When a suspected case was only 12 miles away from Quinnipiac, the university plans were underway.
I decided to pull my leadership team together in nursing to decide, okay, what policies do we want to set for students and faculty who are in the clinical areas, and how might we respond.
Days before the patient was admitted to Yale New Haven Hospital with Ebola-like symptoms, the school was preparing a workshop for all health science students to learn more about disease control.
It was rather quite a coincidence that, the day before we'd made a decision that we wanted to be proactive, and then the very next morning, hear this.
Health science, nursing, and medical students have the prior knowledge. The review of standard precautions was the next step.
And we're trying to emphasize it's not the same level of precautions you would use for Ebola, but until we have that confirmed, case or suspected case, this is what we use. And by using the basic standard precautions, it's going to prevent a lot of the problems later down the line.
Learning basics like putting on gloves and gowns properly, along with properly removing the face masks after touching a contaminated patient.
I think students feel more educated for sure and more prepared. Something that is scary, and it's better to know more than not know what you're getting into.
One of the worst things that can come about from this type of outbreak is the fear of the unknown, or being concerned about things, or having unrealistic fears. So I think that's one of the things that we've been really trying to do, is educate the students, educate the staff. But now that the information is out to all of our health and health-related students, we're hoping that now that fear will kind of be settled down.
Educational videos, lectures, and practice creates the combination of knowing the accurate information and prevents fear.
I think that we know how to handle it. I don't think there's any reason for anybody to panic.
I'm Stephanie Fasano, Q30 News.